Don't brush that off, it could save your life. Let's be honest, getting older isn't for the faint of heart. A few more gray hairs, creaky knees, and the occasional name slipping your mind come with the territory. But some signs from your body? They're not just quirks of aging, they're sirens. Have you ever shrugged off that constant exhaustion or told yourself chest tightness was just indigestion? That little voice inside you, the one that whispers, something's off, might be smarter than you think. And ignoring it? That could cost you your independence, or worse. Medical professionals agree, our bodies give us subtle clues before bigger issues arise. After 60, the line between normal aging and a serious health crisis becomes razor thin. You don't need to live in fear, but you do need to live informed. This deep dive breaks down 6 symptoms doctors consider too dangerous to ignore, why they matter, and what you can do, starting today, to protect your future. 1. When tired isn't just tired, unexplained extreme fatigue. We all know what a rough night's sleep feels like. But what happens when you're sleeping soundly and still waking up completely drained? Or when even folding laundry feels like running a marathon? Doctors see this all the time in patients over 60, and it's not about getting older. It's your body sounding the alarm. What it could mean. Persistent fatigue can be a sign of heart disease, especially congestive heart failure, kidney dysfunction, undiagnosed cancer, anemia, chronic infections. When the body is under stress or fighting an internal enemy, it reallocates energy to deal with the problem, and that leaves you running on empty. My take: why we brush this off. We live in a culture that idolizes productivity and downplays rest. Seniors often feel guilty for slowing down or being lazy. But there's a world of difference between choosing to rest and being forced to. What to do? Track when and how often you feel this fatigue. Check if it interferes with normal activities like walking, cooking, or even talking. Bring a journal of symptoms to your doctor and request blood tests, CBC, thyroid, iron, vitamin levels. Heart function tests, EKG, echocardiogram. Kidney panel. Don't power through. Energy loss is often the body's first whisper of something serious. 2. Crushing pressure, the chest pain you can't ignore. Chest pain is the classic heart attack symptom, yet countless seniors dismiss it as heartburn or a pulled muscle. That hesitation can be fatal. Recognizing the warning signs. Pain or tightness that radiates to your jaw, back, or arm. Sweating, nausea, dizziness, or trouble breathing. Pain that worsens with exertion. These may be symptoms of myocardial infarction, heart attack. Aortic dissection, a tear in your largest artery, a surgical emergency. Angina, restricted blood flow to the heart. Let's get real, time is everything. Doctors have a saying, time is muscle. Every minute that passes during a heart attack means more heart tissue dies. And the longer you wait, the harder it is to recover. Your move. Don't lie down. Don't wait and see. If the pain is severe or unusual, call 911 immediately. Chew an aspirin while you wait, unless contraindicated. Better to have an unnecessary ER trip than a missed chance at survival. 3. Out of breath doing nothing? Take it seriously. Shortness of breath isn't just about being out of shape. When simply walking across the room or climbing stairs becomes a struggle, something deeper may be wrong. Conditions to rule out: congestive heart failure, pulmonary embolism, a lung clot, COPD or pneumonia, silent heart attack, COVID-19 or other respiratory infections. What's silent but deadly? Older adults may not feel the classic signs of a heart attack. Shortness of breath might be the only clue. Similarly, pulmonary embolisms can start subtly, a little wheezing, mild fatigue, and progress rapidly into a crisis. Daily insight. Ask yourself, Do I get winded doing things I could do easily a year ago? Is it worse when I lie flat or at night? Am I coughing or wheezing without explanation? Get checked. Lung and heart imaging, oxygen levels, and lab work can help identify culprits early. 4. Losing weight without trying. Time to investigate. In your 20s, dropping pounds without effort might have felt like a blessing. In your 60s or 70s, it's a cause for concern. What it might point to: gastrointestinal cancers, pancreatic, stomach, colon, diabetes or thyroid disease, malabsorption syndromes, e.g., celiac disease, chronic infection or inflammation. The scary part: you might not feel sick at all. But your metabolism is overactive, your immune system is in overdrive, or your digestive system is malfunctioning, and your body is cannibalizing itself for energy. Check your belt. If your clothes suddenly feel loose, or family starts saying, "You look thinner," don't wait. Weight loss of more than 5% over 6 months, without changing your diet, is worth medical evaluation. 5. When the mind wavers, confusion or sudden personality shifts. One moment you're chatting normally. The next, you forget why you entered a room, or can't follow a basic conversation. We all have senior moments. But sudden mental changes signal something more dangerous. What it might be: stroke or mini-stroke, TA. Urinary tract infection. Sepsis. Rapid onset dementia or brain inflammation. Real talk, UTI-induced delirium is real. One of the most overlooked causes of confusion in seniors. A simple bladder infection. It can cause hallucinations, anxiety, aggression, or complete disorientation, with no fever or burning. Know the signs. New forgetfulness. Personality changes. Trouble speaking or reading. Wandering, irritability, or sudden withdrawal. Seek immediate help. Cognitive decline isn't always slow, sometimes it's a flashing red light. 6. That bellyache might be a time bomb. We all get indigestion or stomach upset. But if the pain is sharp, persistent, or radiating to your back, don't ignore it. Critical conditions linked to abdominal pain. Abdominal aortic aneurysm rupture. Intestinal ischemia. Pancreatitis. Gallstones or blocked bile ducts. Red flags. Pain lasting more than a few hours. Pain with vomiting or fever. Swollen, hard belly. Blood in stool or black tarry stools. At this age, abdominal emergencies are more common and more dangerous. Every hour counts. Conclusion: don't panic, but don't wait. Aging gracefully doesn't mean ignoring warning signs. The 6 symptoms we've explored today could signal serious illness, but they're also your opportunity to act. Extreme fatigue is not just aging. Chest pain is not always heartburn. Shortness of breath is not just being out of shape. Unexplained weight loss is not a bonus. Sudden confusion is not just getting old. Persistent abdominal pain is not something to sleep off. Your body talks. Are you listening? You know your body better than anyone else. If something feels off, don't talk yourself out of it. Ask questions. Seek answers. Push for testing. Staying informed isn't just power, it's peace of mind.